compared to mobilizing the joints and strengthening the muscles. And one of the things I want to get everybody to understand is that it's not just a real quick, easy fix. I mean, a lot of times you have to apply some science to the area that's injured. So what we do at the office when somebody comes in with an injury, we mobilize the joints, we make sure that they're moving properly. Then we apply what's called cold laser therapy. Cold laser therapy is an incredible technology. And what cold laser therapy allows us to do is there are studies that show that cold laser therapy is also known as light therapy. And what low-level light therapy has been proven to do, it gets down there and it's able at the cellular level to alter the DNA and help restore normal cellular growth and normal cellular uh, strength back to the injured areas. So we utilize that at the office. We utilize electrical muscle stimulation, and of course we do some manual manipulations on the injured area if it's possible. Now, if you have a complete tear, then what you may need to do is you may need to look into something like a surgery. We had a patient several months ago who had almost a 100% rupture of his Achilles heel, or excuse me, his Achilles tendon. So what we did, we applied some cold laser to him, sent him out for a surgical consult. He didn't need to have the surgery. We brought him back in the office, applied some motion, applied some cold laser, some electric muscle stim, and he got better. And you can get better as well. And so the thing is, going into it, we assumed it was going to be a several month process, but using that laser therapy and doing the mobilization, he was back and ready to go within a month. And that was an incredible healing story. But we have those day after day at the office. You know, grade 2, grade 3 sprains, strains, they're healing within 2 weeks. So it's unheard of. As long as you allow the body to heal in its natural state, it's going to get better, and it's going to get better quicker. Now I have a caller on the line, George. George, this is Dr. Nymphius. Can you hear me? Yeah, absolutely. Now, tell me, how long ago was the lymphedema? Yeah, when did you have it? When did it first start? Did you have any? Remind me again. Did you have a surgery? Oh wow. Did you have did you have any swelling in the extremities and a lot of fatigue? Okay. What have you done so far? I know you mentioned that you gained a lot of weight since it happened. Is that correct? Okay. What have you done so far in terms of treatment for it? Oh, fantastic. Okay. Yeah, sounds like it. So then, how long were your feet swollen like you described? They're out for a year? Okay, correct. Okay. So then, in the course of that time, that's when you gained the weight you mentioned. Okay, so the course of the year, you gained a lot of weight, and now the lymphedema is corrected. Is that correct? Okay. So then what we need to do is we need to find a way to get you moving again, to mobilize your body so you can, get the circulation going. And if you've gained a lot of weight, there's going to be some weight. It's going to be difficult on your chest to breathe. It's going to be difficult for your heart to pump blood properly, which is probably why you take a few steps and you get tired all of a sudden. Is that correct? Oh, okay, okay. Okay, so then what we need to do, it sounds like it could be a circulation thing where you're just not getting everything circulated like it should. and because of the excess weight down in the lower extremities, so to speak, then it's going to be a little bit more difficult to get you mobilized. Can you, let's see, can you ride an exercise bike all right? Do you have any foot pains or any leg pains or any cramping when you try to exercise or walk? Okay. Are your knees not bending because there's a potential for it being too swollen? Okay. Yeah. Okay. So then, what we may need to do, I may need to examine you so I can see exactly what's going on, because for me to try and give you the best possible advice with something like this, I may need to see what's going on and then modify. Sure. Our phone number at the office is 817-251-6767. Yeah. If you can call up there, leave a message, and we'll get you set up as soon as we can next week. Okay? Do you have any and all medical records? Okay. We have a special discount on our website for the radio show. So if you go to our website, victorychiropractic.com, we've got a special for for the people that listen to the show. Oh, you don't? Okay, well then mention it when you call, and when they call back, they will, or when you leave a message, mention the radio show, and they'll call back and tell you all about it. 251-6767. Okay, George. God bless. Okay, that's a prime example of how important it is. Just because you've been injured, or just because you had a serious condition, there's still time for you to heal. And I personally believe that many people, if not everybody, I don't want to say everybody because that's too broad, but many people want to live a healthy lifestyle, but they're just not sure how to do it. And sometimes they need that extra motivation to get them started. And then we take that motivation, we try to turn it into inspiration. So let's get back on track talking about injuries and how to heal from them. If you've been injured and you've had gone through the rigmarole of trying to recover and trying to rehab, and you're still not where you need to be, then we need to look into. It's probably nothing wrong with the exercises you're doing. It's probably nothing wrong with how hard you're trying. It could be that the biomechanics of the joint you're trying to rehab or the joint you're trying to get better are not accurate or not as working at 100%. See, because joint biomechanics are what the body works on. And when I say joint biomechanics, I mean properly moving elbows, properly moving knees, shoulders, hips, spinal vertebrae. If those things aren't working like they should, then your body isn't going to be able to recover from an injury because your muscles aren't going to be able to contract and relax through their full range of motion. And if your body can't, or excuse me, if your muscles can't contract and relax through their full range of motion, they're never going to be as strong as they need to be. If there's something preventing a joint from moving all the way through its normal range of motion, then that joint isn't going to be as healthy as it should be. And if the joint's not healthy, scar tissue is going to begin to form. And if scar tissue begins to form, then the muscles are going to have a tougher time moving the joint, and then your biomechanics of that particular joint become altered. So if you want to try and recover, you have to have properly moving joints. The biomechanics have to be accurate. If you want to try and avoid an injury, you have to have the proper joint biomechanics. And the proper joint biomechanics are a lot easier uh, said than done to get corrected. And that's one of the things at the office we do is we make sure that joints are moving properly. We make sure that joints can function like they were designed to, which then gives the muscles the proper ability to contract and relax. It gives the joints their full range of motion.